Okay, so ever since I was on a webinar with Eric Barker from TrueRx and his team, I have been having some amazing phone calls with benefit brokers, consultants, and employers the last few months. The topic being, what are we going to do with GLP-1 medications for weight loss, including them or excluding them on employee benefit plans? So here is a couple-minute breakdown of all my touch points from my phone calls recently. So give it a listen. If you have questions, let's talk. But this is basically an excuse to not have to talk to me, right? You want that? So enjoy it. And if this sparks some interest, please reach out so we can get something in motion soon. First question. Will these meds have to be on my plan? They don't have to be on your plan, but they likely will be because of the risk of them not getting covered in the future is too great. It's too great. Yes, that means lawsuits. We are already seeing them and nobody wants a lawsuit. If you are currently excluding them from your plan, you are kicking the can down the road because of the plan language. You can do that. I mean, to what you may ask, well, you're kicking the can until when CMS flips to classifying obesity as a disease. Currently, AMA classifies obesity as a disease, and they are putting heavy pressure on CMS and commercial plans down in DC. Right after Lilly's drug was approved a few weeks ago, we saw lobbying pressure turn up from AMA that week. It's going to happen because the need is so large. The medication is so effective and the pharmaceutical companies are so powerful. The language is already halfway there. It's not going to take much. In 2004, CMS removed the statement from its coverage saying obesity itself cannot be considered an illness. Well, this drug is exposing that statement, so I'm glad they got rid of it. Obesity is a disease of our modern environment, and it's causing a ton of problems that they already categorize as diseases. So, as we see more and more metabolic indications with positive outcomes in randomized control trials by the actual pharmaceutical companies tied to these medications, it's going to flip. I mean, heck, healthcare is changing because of this. Retail and grocery stores are talking about this on their sales outlooks. It is changing consumer purchasing power and behavior. So, you may not have it on your plan now, but you will have to soon. So I would suggest getting in front of this tsunami. It's coming. Another question. If lifestyle support falls into wellness, how can we require it? It won't pass compliance. Okay, so that came up a couple times. Great questions, and everyone who has asked that has had great intentions. Legal and compliance might say it falls into wellness, so it gets tricky if we can tie it to a medication. Well, what if we have actual CPT codes for health coaching, real CPT codes, and in the FDA approvals of these medications, they actually use the words with diet and lifestyle modifications. They use those words for safety and efficacy purposes. Those guidelines tell people what they need to do to be safe and lose the weight, right there in the text. Now, unfortunately, our healthcare system is not set up to support that tiny piece of the puzzle, big piece of the puzzle. Safety, it's like, nah, we trust you. It's not there. Now, efficacy, why would I care about if this is working if I'm paying $1,000 a month for it? Of course I want it to work. I mean, look at what I do to a mechanic if they fix something for $1,000 and I drive off the lot and it breaks again. There's no way I'm going to accept that. It better not break. So why would you accept that now? In our structure, you can place a new drug on your prescription benefit or formulary and also put it into your plan language with some prior authorizations for the medication. So your employee could see a commercial. They could go to their doc can prescribe the medication with approved ICD-10 diagnosis codes. They need to qualify and be medically eligible for the medication. Then they go to the pharmacy, and when they go to pay, they have to pay out of pocket because why? They have not fulfilled their prior authorization requirements to have an intro call with a health coach set in the plan there, so they have to pay out of pocket. They are not approved at the pharmacy level. I mean, this is all explained to them during open enrollment or an employee webinar, but who knows what employees actually retain, right? At this point, when they speak to us about the coaching piece, someone may not sign up because once they learn about the lifestyle requirements and the work, they will say, nope, this is not for me. And that's perfectly okay in the coaching world. This person is not ready for change, not ready for real change, and they would not save their employer any money in the long run anyway. So just this prior authorization alone could be a huge cost protection. Now, if the employee does want to move forward, then once the medication period begins, they will need to have documented CPT coaching codes in order to be eligible for cost coverage at the pharmacy level for next month's medication. As long as it fits in the plan language with CPT codes and prior authorizations, the employers are protected and employees are set up for success. Next, what are the legal risks of covering versus not covering it? So what are the legal risks of covering it versus not covering it? Well, there are two parts to this question. Actually three. First one, I am not a lawyer, but these are just some things I have talked about with consultants and employers as we strategized. And 2 and 3, covering it or not covering it. Both of which require you to do this responsibly. And please, 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 don't just cover it to do your employees a solid favor or you feel pressured to. You need to do it responsibly. If you don't, there are enormous, enormous cost concerns, but also safety concerns for your employees. So be careful. Okay, so if you do not cover it, perfectly fine. You can do that as an employer. It's your decision. 2 risks. You have people leave your company to go elsewhere where someone does cover it. Replacing that employee costs money, anywhere from $5,000 to $7,000 national average right out of the gate. So you don't want people leaving. But next is flat out lawsuits, which I mentioned before. We are already seeing lawsuits against companies that won't cover them. And while we don't know how they turn out, but just know you are vulnerable to get sued down the road. So what if you do cover them? Are you in the clear? Employees are happy, management is just waiting to see what the numbers look like, the ramp is slow, not too bad. Okay, we're good, right? Hold on. 1 to 2 years into this and another problem arises. If you ever want to take it off of your formulary, then you're taking something away from your employees that they depend on to stay healthy. It doesn't necessarily save you any money because they are dependent on the medication to stay healthy instead of lifestyle. You are incurring those costs each month. So you're not necessarily saving money. I mean, you might be, but it's not. It's going to be tight. So if they want it, but you take it off, they have to pay out of pocket. And there are dangerous outcomes of them using this out-of-pocket money on the medication instead of their kids or their mortgage or something like that. Or they can't afford it and they go into depression or even become suicidal at the thought of gaining the weight back. Or they start gaining the weight back and then become suicidal. Now, that last part is extreme, I know that, but it is in the literature as a risk, so we need to acknowledge it. An employer does not want that. Nobody wants that. So that is if you choose to take it off your formulary because maybe it was too expensive or safety risk popped up in the future. But what if you keep it on your plan? There is a sneaky caveat to all of this that not many people are talking about or preparing for. In order to be medically eligible to take the medication, you need to be over a BMI of 30 or a BMI of 27 with 2 comorbidities tied to obesity. Well, if this drug is successful, which it is, then you lose the weight. And if you lose the weight and drop below those BMI levels, and that weight is recorded at the doctor's office, well, you may no longer qualify for the cost coverage. So now what? If you're not in a program with lifestyle support and you're successful, and you may go into a panic. This is a dangerous situation of mental and physical health. And on the weight regain, your employee will likely fall back into because of the health problems that cost you money in the past. Now at Tara, we have patients using this medication and then stop taking it as well, but they have lifestyle leading, so there's never a panic. So, legal risks. Yes, there are some, but you can minimize that with covering it responsibly and leading with lifestyle. When one does that, they are not dependent on the medication, they are using it as an aid, a short-term aid, and lifestyle is the real lead. So, all sounds great. How do I put it on a plan? In the near term, self-funded plans can do this very, very, very seamlessly. But for traditional plans, BUCA plans, and commercial plans, They will be late to the party as they wait for the Category 1 CPT codes for health coaching, currently in Washington, D.C. for approval. If you have one of those plans, then you could add lifestyle medicine coaching as a bolt-on voluntary benefit and make it an incentive. Instead of an Amazon gift card for doing your 10,000 steps or whatever you want, you reimburse the cost of GLP-1 medications if you record coaching engagements throughout the program and report that back to the HR. Then it works, and it's very simple. Employee pays out of pocket, no cost risk to the employer. Employee gets reimbursed for it if they show engagement in the voluntary health coaching program, reported back to the company. The company covers it, but only when lifestyle is leading, so it puts that patient and the employer in the best possible situation. Again, it's a workaround if you're on a BUCA or commercial plan. So if these BUCA and commercial plans are not currently covering the medication, and that's what you tell your employees, like, hey, it's not our decision, it's not covered in the plan, there's nothing we can do about it. Right, that's what you say. But I don't agree with that, because the plan is not covering it because it hurts their margins. And right now, they don't know how to control it, and they can hide behind the CMS decision on obesity as a disease. These plan admins are not out to help your employees, they are insurance companies that want low claims, and they want you to keep paying your premiums and move on. So, until they start covering the medication, in the meantime, you enable this health coaching voluntary benefit, not tied to the plan, and have it in place and ready for when the meds do get on your plan. If you're worried about whether it's a huge cost by doing so, just tie it only to GLP-1 medications, or stop worrying about it. Droves of people don't just sign up to do work to get healthier nowadays. I mean, a few might, and that's a win for you as an employer, but the real utilization and protection will come when weight loss meds come. So this is playing it safe and being prepared and allowing you as an employer to make the decision to cover. You want to stay on offense here. But it's even easier in a self-funded plan. That's where all of our conversations are happening. In a self-funded plan, if an employer is adding this medication to their formulary, the plan admin has to manually do some things for the new medication. And the medication and the medical eligibility prior authorizations. Well, guess what? Since you are already doing work for this new medication, adding a line item for prior authorization, then just add another line item as a prior authorization to be eligible for the program, and additional CPT codes, these Category 3 CPT codes for health coaching, to be recorded and required for the cost of the meds to be covered. So it's just adding another line item. Then all of the risk of these meds and decisions sit in the plan design and are held up due to safety and efficacy. As per the FDA, it protects you as the employer. This protects the employer's budget and puts the employees in the best situation for success. So what does the coaching piece look like? In the Terra program, we are taking a tiered approach to coaching. Our program is a 12-month program, which allows for a lifestyle start, no medication yet, then taking the medication with appropriate dosing up and down with the physician, in different segments of coaching during the whole journey. Nothing happens overnight. First month is one-on-one coaching. No medication eligibility in that first month. Employee gets matched up with a coach for a medical and cultural fit. We need to flesh out the why, the real background, the skeletons in the closet. Actually talk to the employee. It's a great first month. They learn about the medication, they learn about themselves, and they learn about their environment. Month 2 and 3 stays one-on-one, weekly coaching. 4 monthly engagements fulfill the prior authorization requirements to get medication cost coverage. Doc manages the medication dosage. Tara reports back into the plan. There you go. If month 1 to 3 in a bike scenario were training wheels, then 4 to 6 are no training wheels, but we are still running alongside of you, holding the seat when needed. Now this is a bi-weekly coaching call, still one-on-one. A little more responsibility is put on the person, but the coach support never leaves. Coaching engagement is submitted monthly for cost coverage of the med into the plan. Months 7 to 9, same bike scenario. We show up at the park, bunch of other kids are there. You got your first training bike still, a little bit more confident, but this is all new. A lot of kids here, but they call you into the bike park. This is good. This is when we get into group coaching. You learn from others. You talk about your experience, your losses, your fears, your successes. Everyone's going through a lot of the similar things. And you hear about others' problems. Here, you grow, you open up, you really strengthen your foundation in weekly group coaching. Recorded coaching engagements via CPT codes are submitted for medication cost coverage if you are still taking it into the plan design, just like the prior months. Months 10 to 12. All right, we get back into some one-on-one work bi-weekly and then finish off the last month weekly as we develop a future success strategy. Every personal detail in there. Month 12, there is no medication approval. They have graduated and are now testing the waters, not dependent on the medication, but they're still being supported by the coaches right there alongside them. We just used it as an aid in the journey, and now we are confident to move forward. So, this is a structured flow to develop a rock-solid base that will serve as your employee's safe zone, your launch spot, your foundation to move forward on. It is structured like that, all for a specific strategy to bring them along and set them up for success. On the Terra plan, we are seeing people engage in the program or enroll in the program, go through the first month of coaching, and then never start taking the medication because they're feeling better and they want to see this through. They are taking control of it. That is a huge win for not only the employee, but also for the employer, that they don't jump into that pool of medication costs. We are seeing people come on and take the medication for just a couple months, 2, 3, 4, 5 months. They know how it works and they're using it for a small little aid as it gets them over the hump in their journey. And then they're done with it because they never treated it like a dependent medication. They treated it like an aid in the process. It aided them to get over that hump. And now they're good, and now they're leading with lifestyle, okay? So we don't necessarily always go 12 months, and anything under 12 months is a huge win on the cost side, and we're usually doing so because it's successful, okay? So think about that in terms of medication usage. It's going to be lower. Okay, so what does all this cost on the coaching side? Okay, in the Terra structure, coaching is $200 flat per month. Doesn't matter which segment of coaching you are in, it's billed quarterly, so $200 times 12 equals $2,400. In our structure, there is no medication in month 1 or month 12. So for a medication that costs $1,000 or $1,200, 2 months of medication, it could be up to $2,400. So we don't take the medication for 2 months. This is for a safety and efficacy strategy. And this strategy also pays for 12 months of intensive coaching. I mean, that is an amazing value to do a whole lot of good for your employee and also protect you on cost. At no additional cost versus covering the medication blindly for 12 months. You check off legal risk, safety risk, efficacy risk, and cost risk. I mean, that is amazing. Terra bills the plan or the employer client quarterly. So if we do have a person that drops off and we can't get them to re-engage, the employer or the plan is not getting billed for the next quarter. This is paid for usage, just like a prescription. It's not PM like your other wellness offerings. And because we have the plan built for prior authorizations, if they drop off and are not engaging, guess what else they are not getting? The medication covered on the employer's dime. So our structure protects on costs here too. So to recap, there are legal risks to not covering it and also covering it. Employers can protect themselves from both sides. These medications will be on your plan. It would be responsible to get a program in place and get it in front of this tsunami that's coming. If you're playing catch up, you will not be on offense. You can make the decision now. There is a plan structure that fits into any plan that protects the employer on costs and sets up the employee for success. Yes, you can do that. It's here for you. In our plan design, 2 months of no medication pays for 12 months of intensive lifestyle coaching. A win for the employer and the employee. So, we recommend you act now. This is not slowing down. This is the biggest decision of the next decade for your employers and benefit consultants on health plans. We've never seen a medication like this, and especially the need for it. 50% of your employees could be medically eligible for this medication. You've never seen that before. And if this is on your plan, it's $1,000 per month, 100 employees, 50% eligible, 50 employees times 12 months times $1,000 a month equals $600,000 for this medication. It's probably not going to happen like that, but it's a risk. That's a 100 life employer. That's very small. You start stacking zeros on the number of employees there, you get to see how big this gets. Millions and millions. So like I said before, at no additional cost versus covering the medication blindly for 12 months, you check off legal risk, safety risk, efficacy risk, and cost risk. You have to do this. If any of that struck a chord with you, please reach out. Let's talk this through, find out what fits for your plan. But you need to get ahead of this. John at terrahealthcoaching.com, or my personal number is 610-442-7247. Please reach out. Let's figure out a solution to this enormous, enormous situation that we're all staring down the pipe on. Thank you.